Hi everyone, thanks for joining. Dr. Aparna Jaiswal will
Yeah, hi.
Hello, hi ma'am, thank you for joining us. Hello everyone. Firstly, I'd like
Sure.
to welcome Dr. Aparna Jaiswal, Director Cardiologist and Electrophysiologist at Fortis Escort Heart Institution and Research Center, Delhi. Thank you ma'am for joining us today.
It's indeed a pleasure to be here with all of
Ma'am,
you.
so if we can just start like just for for all of us, it's the basics of what would you like to tell us about heart health to start with?
Right. Yeah, so I think if we talk about heart health, we've been doing this for years and years and years together. At the same time, despite no matter how much we talk about it, I think we still have a big deficiency in our lives. All of us, we don't kind of pay as much attention to our heart health. So there's some things which we must remember, and through the next couple of minutes, we're going to keep talking about it over and over again. I think first we have to remember we only have one heart. It's the most precious organ of our body. Like we have a set of eyes, we have a set of kidneys. It doesn't hold true for the heart. There is just one heart. It's very precious and we must make every effort to look after it. We must also remember that heart is a very forgiving organ. Despite the poor lifestyles we hold, it still keeps beating for us all the time. Unlike other organs, wherein without even harming them, they begin to trouble us. What I'm trying to say, for example, our eyes. We don't even do anything to them. Despite that, you get cataract. You will have to change the lens of the eye. But the heart is a very special organ. We don't eat healthy, we don't exercise, we eat junk food, we don't look after our blood pressure. Despite that, it stays on our side. So I think it's time today we come together and look at what can we do for our heart. The heart health comprises of looking after it tenderly. All you need to do is eat healthy and exercise regularly, along with quit smoking, take alcohol in moderation, look after your risk factors of hypertension, blood pressure, and poor cholesterol. It's as simple as this. If we invest few minutes on it, understanding it today, and few minutes every day trying to follow what I said, I think all of us will have a healthy
And ma'am,
heart.
as you said, smoking. So does smoking and lifestyle indeed affect our hearts?
So, if you were to say what is the role of smoking and lifestyle, so in a very simple manner, you have to understand that when we breathe in air, this air goes to our lungs. From the lungs, the oxygen-rich air is taken to our heart, right? And then it is pumped through the body. If you smoke, what happens? You are now taking air which is not rich in oxygen, rather rich in smoke, carbon monoxide, nitric oxide, all of that goes into our lungs. That reaches our heart. From the heart, it goes to the entire body. So you can imagine the effect of smoking, toxic gases, has an impact through our body. It has been noted that people who smoke, if they quit smoking for just 7 minutes, if they leave smoking, their pulse rate begins to settle down. So smoking has a profound impact on our heart, and we must make every effort to quit smoking. Smoking is responsible for formation of blockages, it is responsible for increasing blood pressure, it is responsible for heart attacks. So today I think the focus should remain that we must make an attempt to quit smoking.
And ma'am, like leaving smoking aside, so what are the other major factors that can hamper our hearts?
So the factors which can hamper the heart are: one, if you do not exercise, you're an adult and you don't exercise every day. It's important to understand that we must take out at least 20 to 30 minutes every day to go out for a walk, at least. We must remember that we must keep our numbers well. What does that mean? You must keep your blood pressure on most days lesser than 130 by 80. You must make sure that your blood sugars, a fasting blood sugar, should remain lesser than 100 milligram per cent on most days if you're a diabetic. You must remember that apart from these, if you smoke, you must quit smoking. If you're an adult, it's a good idea to check your total cholesterol. Your lipids in your body should be well controlled. You must make sure that you take alcohol in moderation. You must make sure that your stress levels are well under control. So if you look into all of these factors, there is a good chance that you can make your heart much healthier than it already is.
And ma'am, like if we talk about a little more specific, what is SCA or sudden cardiac arrest for our viewers to know in layman language?
Yeah, so as the name implies, sudden cardiac arrest. So those of you who are football enthusiasts and saw Euro 2020, the captain of Denmark, actually when he was playing the game and representing his country at the Euro Football Olympics, he fell down on the field. He dropped dead. However, he was lucky that there was quick intervention and he was revived and now he is alive. Now that is called sudden cardiac arrest. What does it mean? It is sudden. If he knew it's going to happen, he would not have been there. It's a cardiac arrest because the heart suddenly starts beating chaotically and then stops. It's called sudden cardiac arrest because if we intervene, we can bring our patients back. While sudden cardiac death is something where the patient dies and all biological functions of the body are over. So we together have to understand that A, sudden cardiac arrest is deadly. We can safeguard our patients from sudden cardiac arrest. And if somebody has sudden cardiac arrest in the vicinity, we should know how to do CPR to bring them back. Always remember, it is something which happens suddenly. It's a bolt out of the blue. To give you another example, all of us are well aware of a person, all of us much loved, Dr. APJ Abdul Kalam. He was on a stage in the Northeast. He was delivering a lecture and he dropped on the stage. So if he knew a problem was going to come, he would not have been there. So sudden cardiac arrest is something which happens suddenly, out of the blue, one is unprepared and it can consume a life.
Ma'am, a sudden cardiac arrest and what we heard that the person had a minor heart attack, are they two different things or are they the same thing?
Yeah, so there's two different things. As I told you, sudden cardiac arrest is because of an electrical abnormality in the heart. The heart begins to beat chaotically and is unable to pump blood to the body. There is no blood going to the brain and you fall down. That's sudden cardiac arrest. That's an electrical problem. A heart attack is a problem of the blood vessels of the heart. So when you get heart attack, you get chest pain right in the center of the chest. It can go up to your shoulders, up to your jaw. It can even come to the inner side of your arms. That's called a heart attack because of a blockage of the blood vessels. While sudden cardiac arrest is an electrical problem. One must remember that when you get a heart attack, all of us as commoners, somebody is getting a heart attack, we panic that let's take him to the hospital quickly. Why? Because when you get a heart attack, you could potentially be at risk of sudden cardiac arrest. So you could die because of the heart attack. They are not the same thing. They're two different things. And those people who have a heart attack in the past and have poor pumping of the heart, if the pumping of your heart, which is measured on an echocardiogram and is an ejection fraction, it's a number. If the pumping of the heart is less than 30 to 35%, you are at risk of sudden cardiac arrest. You must talk to your doctor. You may need some devices which are called implantable cardioverter defibrillators, and those devices safeguard you from sudden cardiac arrest if it were to happen.
And as you just said, there are two different things, and we all made aware that these are the signs you should be careful if someone's having a heart attack, and these signs to look out for. Are there any particular signs one can look out for in sudden cardiac arrest, like if someone next to us is happening? Are there any signs that one can take care of?
Yeah, supposing you have a family member. For instance, any of our in our families, we have an elderly male. Elderly male, I mean anybody who's more than 60 or 70 years of age. If he has high blood pressure, if he has diabetes, if he has poor cholesterol, if he's a smoker, if he has a disease in the blood vessels of the heart, he's at a very high risk of sudden cardiac arrest. If he has poor pumping of the heart also, then his risk is incremental. So anybody who has risk factors for heart disease, any one of us, if we have hypertension, we have diabetes, we're at risk of sudden cardiac arrest. We must go and talk to our doctor. Do I have a risk? But in a very simple term, one must understand to prevent sudden cardiac arrest, look after your risk factors well, and you can diminish your risk of sudden cardiac arrest. Means remember your numbers. Remember to exercise 30 minutes a day. Remember to keep your blood pressure less than 130 by 80. Remember to keep your fasting blood sugar around 100 milligram percent. Remember that you have to essentially, in those 30 to 40 minutes, cover at least 3 to 4 kilometers. Remember, you should get your cholesterol down. So these are simple basics and numbers. If you follow these, you will be diminishing your risk of sudden cardiac arrest.
And ma'am, just as you said right now, to quote you, like, if there's a male member in the family who's 60 or 70 above, so ma'am, this heart health and sudden cardiac arrest, is it like, is it anything due to gender that males are more prone to it or females are prone to it, or gender does not have any role to play in it?
So gender has a significant role to play. As women, we are lucky when we are premenopausal because there is a protective hormone that we have in our circulation. The protective hormone is called estrogen and progesterone. So these protective hormones keep high blood pressure at bay. As a result, keep our good cholesterol in a higher number, keep us protected from heart disease. However, one must remember that women, even in their premenopausal years, can develop heart disease, and women who are postmenopausal have lost the protective hormone. Once you lose your protective hormone, you are then at equal risk of your counterpart men to develop heart disease. And it's also to remember that when women develop heart disease, it is even more aggressive than their male counterparts because women have smaller blood vessels.
Ma'am, like just you said that how hormones help in premenopause help women. So these days, currently, we are seeing a very rise in hormonal imbalances in women due to lifestyle and XYZ reasons. And hormonal, I have seen across in few of my friends that it caused an increase in cholesterol as well. So, with due to hormonal imbalances and the increase in cholesterol, can women at an early age be at a little risk of heart, and should they be extra careful?
Absolutely, and I'm so glad you brought this up. While nature protected women by giving them the protective hormone, we as an evolved society and because of globalization are going against the law of nature and inviting the disease by not utilizing the protective hormone well enough, meaning thereby more and more women, younger women, we see are developing high blood pressure, they are stressed, they take alcohol, they smoke, they do not exercise, have a sedentary lifestyle, develop diabetes, have poor cholesterol. As I enumerated, all of these together make a perfect combination for developing early heart disease.
Ma'am, just one more doubt that I had that recently we've been coming across, if we take our own Bollywood, for example, a lot of young Bollywood men that we are seeing who are supposedly very fit and they're gymming and, they all have a perfect body and say they eat very healthy, but we're seeing a sudden rise at the age of 40s that they are dying due to heart issues. So is there any particular reason because of that? Because we have always looked up to them as being healthy and fit, so then one doesn't understand.
Yes, I completely agree with you. So, as we always say, the starting sentence in sudden cardiac arrest is it's a very heterogeneous disease and it is an enigma because it also affects the young who apparently we think are healthy. Apparently we think are healthy because the factors are multifactorial which causes sudden cardiac arrest. So to re-enumerate them, while lifestyle diseases like hypertension, diabetes, cholesterol, smoking, alcohol, stress, sedentary lifestyle are all well-known risk factors. There are certain risk factors beyond this, There are certain risk factors which we can now have special biomarkers to pick up. We do some lab tests to pick up if you are at risk. There are genetics which come into play. There's something called plaque ruptures which take place. So even in people who we think are healthy are actually not healthy. But we should not focus on that small component. We should focus on the majority of the people, more than 90% of the people who succumb to this disease because of the risk factors are enumerated. So if you look after yourself well enough by taking care of your blood pressure, remember the number, less than 130/80. If you look after your fasting blood sugar, less than, for a diabetic, for less than 100, non-diabetic, well, 100 to 110. If you make sure you exercise every day, 30 to 40 minutes every day. You keep your total cholesterol less than 200. You make sure you are covering a distance of about 3 kilometers in 30 to 40 minutes. You make sure you don't smoke. You take alcohol in moderation. If you look after all these factors, you will ensure that you reduce your risk of developing heart disease and your heart is
And if
healthy.
we talk about heart diseases and heart health, does heredity have anything to do? Like if I have a family history of heart issues, am I more at risk, or it has nothing to do with heredity?
Yeah, so genetics play a large role in all of us to develop some diseases. Heart disease is one of them. However, we all as doctors believe that you can play on your genes to a significant degree by doing what I just said. Just sitting there and blaming it on your genes or waiting for heart disease to hit you because it is in your genes may not be the best thing to do.
And ma'am, like we are seeing so many post-COVID complications, like we are seeing lung issues, and recently I read there are gut issues also coming. So does COVID anyhow harm the heart in post?
Yeah, so COVID has had a significant impact on us physically, emotionally, socially, economically, in every way. And if I were to say physically, I think it has affected most of our organs. It has affected our heart significantly. When we did cardiac MRIs of patients who got COVID infection, it was seen that it was 60 to 70% of people who had an inflammation of their heart because of the COVID virus. So what does one do? Most important thing is protect yourself from the COVID virus. Make sure you follow the norms given. Supposing you get COVID infection, you must go to your doctor, must take the required medications, must take adequate rest. If post-COVID you continue to have some symptoms, visit a cardiologist. Make it a note that you get yourself investigated if you're having anything called myocarditis. That means inflammation of the heart because of the virus. So any symptoms like breathlessness, palpitations, heavy heart, chest pain, any of these undue symptoms, visit your doctor. So COVID essentially means that you must look after your heart if you've had any of these symptoms. And if you're already a heart patient, you're at a higher risk of having problems after COVID. So look after yourself more carefully.
Ma'am, firstly, I would like to say thank you for such an insightful session. And ma'am, any parting thoughts that you'd like to conclude with to summarize for some people who have maybe joined a bit later also?
So as I said, the next few minutes we're going to talk about the healthy heart, and it will be a worthy attempt by you and then by me if these few minutes are implemented in their daily life. So all I want to say is remember your heart is very forgiving. It allows you to do back to it and yet keeps beating for you. In this session, I want to tell you, let us together pledge to look after our heart by just following a good, healthy lifestyle, eating healthy, exercising every day, quit smoking, take alcohol in moderation, do not follow a sedentary lifestyle, reduce your stress levels. So if you were to do all of this, I think all of us will have a much healthier society.
Thank you so much, ma'am, for sharing all these insightful information to everyone.
Thank you so much. Goodbye.
Bye-bye.